Infection diseases are particularly important for children who travel and interest the travel medicine even in pediatrics. So we have to consider that travel medicine is something quite often and quite frequent because we have children who comes with their family as immigrants or children who lives in Italy or lives in Europe and travel to go to visit friends and relatives. There is some news, some important things to consider for those children who goes in the so-called developing country that mainly are poor country with different epidemiological and hygienic conditions. And for this reason, we have to prevent the disease that those children can acquire when they go to visit friends and relatives, which are the most frequent diseases that they can be affected. First of all, especially if those children came from parents and families that are born in those countries but are born in Italy or in Europe and so are European 100%. These are mainly gastroenteritis and bowel infection diseases. So for this reason it's really very important to consider the safety of the food and especially the water. And in any case, do the vaccination that can be typhus vaccine and even cholera vaccine. We know that in Europe there is available cholera vaccine that can protect with those kind of enteropathogen that are more frequent in those countries. The other important disease that we have to consider is the malaria. Malaria often is very frequent, especially in African countries, where the epidemiological situation of the falciparum kind of malaria is very frequent. So this is important. It's important to educate the family and the children to prevent the bite of insects, because this is the most effective and the most important and most safe kind of prevention for all those diseases that are transmitted by mosquitoes or other kind of flies, and it means malaria and dengue. So it's important to cover these children. It's important especially not to go and stay outside late in the afternoon. And it's important to have the mosquito net over the bed and at the window. Another possibility for the prevention of malaria is use these drugs that are used even for adults, perhaps is atovaquone and those based with atovaquone and pyrimethamine. And there is a drug that is called mararone that is also in tablets for children with a dosage adequate for children for 11 kilo. So 1 tablet a day can really prevent the serious diseases, the serious complication of malaria.